Welcome everyone to our conversation about the sacerdotal functions of health professionals. Health professionals as shamans, exploring spirituality, religion, and ritual in the healing arts. I'm Jim Burko, Senior Associate Dean of Religious and Spiritual Life here at the University of Southern California. And we are really pleased to co-host the IIHW event. We've been looking forward to this happening for a long time, and we're thrilled that we have this incredible lineup of speakers and events. And I'm personally delighted to be part of it. I've been on the steering committee for Institute of Integrative Health and Wellness here at USC for about 12 years. And it's just a wonderful community of people who care about patients as whole human beings. I think if there's any one unifying energy and intention behind this effort, it is this. It is to pay attention to patients as complete beings, body, soul, mind, spirit. And that's what brings us together and getting into all these different aspects of what that means and how we can live that out as professionals in the healing arts. I've thought a lot about this topic of health professionals as priests or shamans, if you will, in many contexts. What really got me started on it was my involvement at Keck School of Medicine here at USC as one of the mentors, the teaching mentors in the professionalism course for our medical school. Introducing our students to the professional issues, the cultural issues that relate to patient care, the doctor-patient relationship. And part of that relationship, very much an important part of it, is this whole matter of what you might call the sacerdotal functions of medicine, of the healing professions. How ritual plays out, how spirituality becomes a factor. And so that's been a big focus of my work as a medical educator. And that's the topic I'd like to explore with you right now. First, let's look at some issues as they arise in the whole question of what religion is and spirituality, just some backdrop for this conversation. Get some definitions down. Here in our conversation, when we talk about religion, we're talking about a system of beliefs and practices that are connected to a community of some kind. And it's supported by rituals that relate to the sacred, the divine, to God, ultimate truth, ultimate reality. They can be public, social, institutional, but they also can have private and personal and individual manifestations. Spirituality, on the other hand, is one's personal relationship to the transcendent or the ultimate reality or God. And that can take the form of religion or not. One need not be religious in order to be spiritual. So religion can be said to be the communal or institutional aspect of spirituality, spirituality being the personal manifestation of it. Now, in the United States, and the culture that surrounds us here in this event, things are changing and have changed a lot over time about religion and spirituality. And that has implications for all who are in the healing professions. Once was a time when religion and spirituality was very much about religion. It was very much about its institutional manifestations. But more and more over time in our culture, the focus has shifted toward individual experience of spirituality. So just this one statistic here, it's kind of an old statistic, but I think it's probably it's only going in one direction. And that is that in 1962, only 22% of Americans said that they'd had some kind of mystical or personal religious experience. Now, people were religious, but their focus of their religion was in the communal practice of the religion. So only 22% of Americans at that point claimed to have a personal, individual kind of religious or mystical experience. Into the 2000s, we're at 49%, a tremendous increase. So it's a sign of this individualization of spirituality, to focus more on spirituality as opposed to religion. Also, we're seeing a tremendous drop-off in affiliation with religion in the United States. More and more people are seeing spirituality as mattering to them and not religion as in its institutional forms nearly so much. Over 30% of people between the ages of 18 and 29 are now unaffiliated with any religion at all. That's a tremendous increase just in the last decade or two. At the same time that there's less religious affiliation, there's still very strong interest in spirituality and religion. Books on the topic fly off the shelves, both physically and virtually. Podcasts and all sorts of media relate to this topic. It's a very lively topic, despite this decrease in formal religiosity. Part of the trend is a trend towards what we call heterodoxy. By that I mean people are putting together religious ideas into their own personal package of beliefs and practices. Now we're at a point where 29% of Americans believe in reincarnation, including 1/10 of evangelical Christians who do not hear that message about reincarnation from the pulpits of the churches that they attend. Same with astrology. Also, this idea of spiritual energy being in physical objects. So things are changing. Now, one thing that hasn't changed a lot over the years is the doctor versus patient gap. And this probably applies to other medical professionals as well. But as of 1999, 75% of patients, the general public, shall we say, 75% of them believe in God or have some kind of formal religious belief. With doctors, a very different percentage, yes? 65% do not have formal religiosity or belief in God, etc. So there's a big doctor-patient gap here. And this has real implications for the way professionals relate to their patients. It can be challenging, and that's part of what we're discussing here. Again, these statistics here are for doctors, but it's certainly overlays onto other professionals as well. Now, a big function of spirituality and religion for patients is the process of meaning making, integrating an experience they've had of illness or injury. How do they make sense of it? How do they explain it to themselves? How do they fit it into the narrative of their life story? That is a crucial question, and it's a very important part of the sacerdotal function of medical professionals, is to help patients make meaning and integrate their experiences. And that's part of what we mean, I think, about institutive integrative health, integrating not only the different modalities of healing, but also helping patients integrate their healing journey into their life story. And of course, religions, many of them, not all of them, but many of them are about narratives, yes, stories. That's particularly true with the Judeo-Christian tradition. Yes, it's based on stories. Everything about it is woven into stories. And those stories become personal. They're integrated into people's personal stories and help make meaning of illness and crisis. And it's something to ask about. asking patients what their illness means to them. That can lead to really profound and important conversations that can contribute to their healing process. And there's a lot of data to support how important this is. Now, there's been a lot of, in the popular literature, popular culture about religion and spirituality and healing, there's a lot of conversation about the effect of prayer or participation in religion, its effect on patient outcomes. And what we find generally is that there's a strong relationship between religious participation, belonging to a community, with longevity and overall health. But there's not a lot of evidence that suggests that specific prayer practices, particularly intercessory prayer, me praying for you to get better, has any positive health outcome. There are really interesting and important variations among specific religious groups regarding their health outcomes and health indicators. And that gets very interesting, but we don't have time to pursue that here. But some religious groups have extremely good health that relates to behavior that falls out of their religious beliefs and practices. Seventh-day Adventists are a great example. So how do we work with patients around their spiritual needs? How do we get at their experience, how they see it, how they make meaning, how they integrate their religious or spiritual practices or communal life with their healing process? So there's stuff to look for, right? Visual clues, what do you see around the bedside, holy cards, sacred books, verbal clues, the words that they say, and helping, working with them to find out what those phrases mean. It's sometimes we can have opinions about, make assumptions based on what people are saying. They may or may not be accurate. One is this whole idea of, if it's the will of God that I get better, if God wills it. That can sound like a kind of fatalism that might fall out of a religious belief. And that might be an issue. But on the other hand, patients may find a great deal of comfort in that idea of giving over their lives to the will of God, whatever that may be. And it might actually give them a sense of agency to do that. Ironically, that might elude us as medical professionals at first glance. So exploring what it means for them to say these phrases that are hints about their spirituality. That's something that's part of the midwifery of being a health professional, part of the shamanic or priestly function that you have. So this is a great question to ask, a simple screening kind of question. Often spiritual beliefs help patients. I want to ask you a few questions so I can address as many avenues of assisting you that I can while you're here about these practices, beliefs, and affiliations, right? What communities they belong to that might be of a support to them, religious or otherwise. Patients will sometimes ask you to pray with them. And there are ways to do that honor your boundaries, honor your proclivities or beliefs or non-beliefs. Referring people to chaplaincy service is a huge benefit for patients. Chaplains can find other health professionals to drill down deeper with them, to assist them in their meaning making and in integrating their religious and spiritual practice into their healing process. So just some overview on this part of it. Again, active participation in religious community or any other kind of community really is very strongly associated with positive health outcomes. The content, less strongly related, but there's so much more to learn about that topic And we're starting to learn more, getting more science on that topic, which is our next exploration. I love this sign. I saw it on the front of a Starbucks restaurant a while back. Take comfort in rituals. That's me right now, taking comfort in the ritual of drinking a hot brown beverage. And we all engage in different kinds of rituals. We might not call them rituals, but all of us need and appreciate rituals, including patients who appreciate the rituals of medicine, the rituals of healing. Think of it. When you go to the doctor, you make a phone call or you get on the computer to make an appointment. That is a ritual. When you show up at the doctor's office and you sit in a waiting room, the waiting room is a ritual space. It is a ritual act to sit in it. Then a person in ritual garments, the nurse, wearing ritual garments, a white outfit, comes in and ushers you into another ritual space, the exam room, whereupon you put on a ritual garment in there, the gown, right, that covers your front. And there you are in another ritual space. And then another person comes in wearing ritual garments, the white coat and the stethoscope and other accoutrement of healing. And you have a conversation that's very often of a very ritualistic nature with that person. And then at the end of the process, maybe this person writes a prescription. Now, in the old days, when you had a handwritten RX, that was a very ritualistic act, was it not? The doctor to write something in unintelligible script on a little scrap of paper and hand it to you. And then you take that to the pharmacist, and that's a ritual too at the pharmacy. Every aspect of this is ritualistic. Now, actually, there's some science about this that's been explored about what's been lost in the electronic medical record by not having that slip of paper anymore. It has an effect on compliance with the prescription because the ritual is powerful to receive the paper and to take it to the pharmacist. So this is a real issue, practical issue that falls out of a ritual act. So it's all ritual all the way down. You are a shaman if you're a health professional, whether you know it or not. Are you interested in getting good at shamanism? That's the question for us today, for our conversation. Just to go a little deeper on this, it turns out that the placebo effect, maybe you've heard the news, the placebo effect works even when the subjects of the research have been told that the medication they're taking is a placebo. You tell them it's a sugar pill, and the placebo effect still works. And the researcher delved into this and came up with this result, Ted Kapchik at Harvard. He says, the placebo effect is the specific effect of the ritual of medicine. All these things we just described. The ritual aspect of medicine itself has a healing effect, and that is the placebo effect. Now, this relates in some fun ways to Hebrew scripture. There's a great passage in the 3rd chapter of Ezekiel where the prophet, speaking for God, says, "Son of man, eat what is offered to you. Eat this scroll and go and speak to the house of Israel." So he gave me the scroll and I ate it, and it tasted as sweet as honey. So there's a little image here that's some fun. It's a picture of a honey cake with this passage from the scripture written on it. So you can eat the scripture. Well, literally you can eat the scripture, and it will taste as sweet as honey in your mouth. So this idea that there's power in religion and spirituality that has a physical effect, right? A taste in your mouth. that can have that can change outcomes. Then in Christianity, we get to think about this too. We've got this tradition of the Eucharist, the bread and the wine of the Eucharist, that are the body and the blood of the Christ, depending on your level of belief in the literalism of that. So it's a good question to ask. Maybe there is some kind of placebo effect, if you will, that comes through the Eucharist. But again, back to Ted Kapchuk, he did some further research on the placebo effect, and he found, he's done the fMRI on the placebo effect, and he's figured out the neural pathways, the biochemistry, the psychobiochemistry of the placebo effect, and has determined that, in his opinion, it's highly likely that we'll be able to come up with an actual drug that has the effect of the placebo effect. A placebo drug that has actual content to it that actually changes the brain and has the effect of the placebo effect. So then when you start thinking about these religious rituals, you begin to wonder, maybe there's some biochemistry going on here. There's more than meets the eye, or even the imagination. The ritual aspects of religion may turn out, with further research, to have medical effects. This is a place I go every year in New Mexico, the Santuario de Chimayo in northern New Mexico, just north of Santa Fe. Beautiful old church made of adobe dirt, and in the back of the church is a hole in the floor, the adobe floor, full of dirt. People take the dirt and rub it on whatever part of their body ails them. It's a ritual, yes? It actually there's no Catholic theology about dirt. There's no doctrine of dirt in the Catholic Church. It's a folk tradition that just stuck, and the Catholic Church can't do anything about it. It's too popular. Thousands of people go there every year. So it's just a sign of how ritual and the movements and the physical movement of it, and the visuals of it and the tactile experiences of it are very powerful. How can you, as a medical professional, as a healing artist, make the most of the inevitable rituals that go with your work to benefit patients? That's the question. And this has a lot of history, right? The Greeks were serious about this, about the rituals of medicine. Why? Because it's all they had, right? 600 BC, what kind of drug therapy was there? What level of surgery could they do? Hardly any. So the doctor-patient relationship was enormously important to them because it was the most important modality that they had for healing. So there's, extreme detail and instructions in the Hippocratic precepts. We all know about the Hippocratic Oath, but there's a whole body of literature from ancient Greece called the Hippocratic precepts about how doctors should relate to patients in extreme detail. What angle should the chair be that the doctor sits in, or the medical professional sits in, next to the bed of the patient? At what angle should it sit? Should it be placed? What kind of clothing should the medical professional wear? And the precepts say distinctive, but not too distinctive. Distinctive to separate you from other people visually, but not to distract the patient, and so on. Page after page of this from ancient Greece. What can you do to maximize your role as a shaman, as a priest in the healing arts? Another major function that you all have is meaning making. Again, we talked a bit about that. Healing professionals can be midwives in the patient's process of making meaning and coming up with new narratives for their experience of illness or injury. And very often, religion and the narratives of religion can be a framework with which you can help the patient make meaning, and that meaning making is part of their healing process. It can have physical effects on them, and we're wired for this. There's a great passage in Oliver Sacks' article that he wrote years ago. He's the famous doctor who talks about brain injuries and strokes and migraines, etc. And he talks about the myoclonic jerk, which is that jerk you get just as you're falling asleep. And so often we make up a story about this experience on the spot. All in less than a second, we come up with an explanation in our minds, in our dream, about why we made that jerk. Instantly, like that we're falling off of a curb or something. And it's just, we're hardwired for this. We need meaning, like we need bread. That's why Ezekiel was offered the scroll to eat. Man does not live by bread alone, according to the scripture, nor by medical prescriptions either. I think I'll pass on this. It's all about the fact that human beings reason with stories. They reason with emotions. And when we're working with patients, we have to recognize that this reason is not just the cold logic of computers or the cold logic of biology. We reason with our feelings. And so we've got to work with the emotions and feelings of our patients in their healing process. So to finish, again, spiritual and religious beliefs and practices. I do want to make a distinction there again. Religion is not just about beliefs at all. A lot of people think religion is belief, but so much of it is about practices. And that's critical for understanding. Ritual practices, meditation, contemplative practices. They can impact health and health outcomes. Communicating about spirituality and religion is critical cross-cultural skill that needs practice and development. Use your chaplains, use your religious professionals, particularly ACP, Association for Clinical Pastoral Education, trained chaplains. These are interfaith chaplains. They're not about proselytizing. They respect all the world's religions. These people can be very useful professional counterparts and comrades in the healing process for you. And think about how you arrange your office, your patient encounters. What are the physical arrangements in your space? How can you maximize the appearance of your space and the functionality of your space purposely to improve the ritual experience for your patient? And that's the conversation I want to have with you now about how to do that. Great to be with you. Thank you. Let's have that conversation. I'd love to hear from participants about how you employ ritual intentionally or unintentionally for that matter, and imagine together some ways that you could refine that ritual or sacerdotal aspect of your healing work. I think one issue that's come up a lot in my work with medical education has been this whole question of like, okay, that's all very nice, but how do you do it in 10 minutes, right? In the length of time you have for an exam or a patient encounter. And doctors in particular really are under the gun for the use of their time. And that's where I think the environmentals, the physical arrangement, and the way you use space, the way your space is invitational for a conversational about spirituality, about deeper things, about meaning making, really can be very powerful. I think medical professionals can do a lot in a short period of time to advance patient outcomes with their ritual work, or intentional sacerdotal work, and also meaning making. You can do a lot in a short period of time. A pithy question, you might not have a long time to discuss it with the patient, but just to ask the question alone can be very profound and powerful, and stimulate thought and meditation for the patient afterwards. There was one doctor that I met over at Children's, Dr. McKenzie, who he would do with his patient interviews with teenagers. He would hold their hands and do acupuncture while he interviewed them, right? He didn't tell them, oh, I'm going to do acupuncture on you. He would just do it, right? While they're talking. And they begin to realize this doctor is taking care of them, right? As they talk, silent, without words, as they're talking to him, he is taking care of them. So there are methods like that, means like that, that can be used to get to a very deep place in a short period of time, maximizing the time that you have with the patient. Yeah, the whole matter of asking questions about spirituality. And again, I think this, for folks who are not religious, medical professionals who are not religious, again, there's sort of this cultural assumption that religion is about beliefs. And again, back to this heterodoxy issue. It really gets interesting. Somebody may tell you that they're Jewish, but then you look next to the bed, at the bedside, you see a table there with the Bhagavad Gita, the Hindu scriptures on it, or some Buddhist literature. So people, just because they say they belong to this or that religious faith tradition, that may say nothing about very little actually, about their practice, their level of practice or nature of their practice of their faith anymore. Yeah, I think here in Los Angeles, we have, over at County Hospital, we have, great majority of the patients are Hispanic, many of them are Catholic. But boy, you start exploring how they do Catholicism, what that means to them, you'll get layers and differences all over the map, because there's folk traditions woven in. The Catholic Christian faith is syncretistic. It's absorbed a lot from Mesoamerican traditions. And heterodoxy is happening there too. So the folks may have just a wide variety of practices and ideas and beliefs as well that may affect their outcomes. So being a midwife for the birthing of some kind of meaning making for what's happening to them by asking questions and guiding questions that get them to connect that meaning making with their faith tradition. That's something you can help with, but that's something that chaplains are really, really, really good at. And they are our chaplains at County are terrific on this. And what they'll do is if they can't, if they think a patient needs some outside spiritual guidance that relates to their tradition or their practice, they'll bring them in, right? And find people that they know can work with them in a creative way to connect medical advice with the meaning making that comes from their faith tradition. So they know who those people are. They can be the bridges between their religious tradition and what the medical professionals are saying and doing with the patient. Very important. Not everybody who's a Jehovah's Witness is going to turn down a blood transfusion, for example. You think that's what they'll all do, but no, it's much more complicated than that. Not every Christian Scientist is going to turn down medical care, even though we associate that tradition with not going to doctors. And the list goes on. Again, having to do with heterodoxy, but also just having to do with intra-religious diversity of belief and practice within particular traditions and ways of interpreting the faith. Sometimes patients will believe that that their health issue is a punishment, right? A divine punishment for something that they did wrong. And this is where bringing in a religious professional to help them work through that and maybe get to a different place around that can be very critical in the outcome, right? Because if a person thinks that they're being punished and that they deserve what has befallen them, they may resist or reject treatment. That has been known to occur. Or unconsciously, they stop going with the program because they have this deep-seated belief operating. I would just add another very common circumstance in this country is a consequence of the New Age positive thinking culture that is seeped into all sorts of religious traditions and is just part of pop culture. The idea that you create your reality with your mind, that there is no objective reality. It's all created by your thoughts, right? So if you think negative thoughts, negative things will happen. If you think positive thoughts, positive things will happen. The law of attraction. There's a film that came out several years called The Secret, which is all about, a very popular film, all about this idea, right? That's woven into all sorts of religious and spiritual practices, seeped into many different religious communities. Big deal in the prosperity theology of Christianity, New Age, Christian Science, science of mind, et cetera, et cetera, et cetera. Many manifestations. Now, what sometimes happens, certainly not always, but sometimes people who have are steeped in that tradition will come to the conclusion that if they're sick in a dire way, if they're in serious illness, then they begin to question whether they've had positive thoughts and whether they need to, that it's their fault then for having had negative thoughts that resulted in the disease. So that's another thing where midwifery from the shamanic function of doctors and health professions can be very, very helpful to draw that out. Okay, what is that belief? And we're here now. We're here now. Now, what do we do positively? What thoughts can you project in a positive way now? Let's not think about the past. Let's think about the moment. Let's not blame ourselves now. Let's go from here. So it's a way of working with beliefs, not arguing or trying to change them, but working from within a frame of reference. And medical professionals can help a lot with that. Any questions? Yeah, that's is that for me or that's for everybody, right? Alexa?
That's for you, Reverend.
Oh, for me, yeah. Well, yes, the thing to remember is I'm a chaplain to students and staff at the university. So I'm not a health professional in that way. But I do the work that I'm describing, I've done with students and staff. I do it all the time, right? So if they come to my office, they will discover that I've got a whole kit there, right? And I invite you all to consider doing the same. Have stuff, right, available. Now, it doesn't mean that you have to believe in everything that that's there, like believe in. Again, think of it in terms of practice, right? Start there. Practices, and also just accessibility, where patients feel like, oh, that looks familiar. That makes the professional accessible when it comes to their spirituality. So, right here, I'm at home now, but from my office, I brought my supply of Chimayo dirt, right? The sacred dirt from Santuario de Chimayo, New Mexico. And I have been known to sprinkle this on the hands of students who are in dire straits of various kinds, or rub it on their foreheads. And it's powerful. It's you can feel that something is happening of a healing nature with people in the circumstances where that's appropriate, which is, this is something where it takes practice, right? Practice as a professional to sort out, when should I pull out the dirt, right? With whom is this going to be meaningful or useful, right? And other people forget about it. It's not going to work. It's not going to help, right? So that's why I have a kit. So I have sage, white sage bundles. I've been known to take students outside, light the bundle, and sage them, right? Now, that can be a problem in terms of cultural appropriation, and I have to be sensitive about that too. I don't want to offend people, and I certainly don't want to offend Native Americans. But if it's going to help somebody, I'm going to do it, right? If I think it could be useful, I will do that. I have oil for anointing in my office, an ancient Christian practice. And I have anointed all sorts of folks, Christian and non-Christian, who found that very meaningful and powerful. It's, for one thing, it just feels good. You rub the area on the forehead between the eyes with oil. Just that massaging in that one spot is a powerful thing to take people to a different place. I have holy water. I have holy beads. By the way, beads are a way of prayer around the world, right? The Hindus had prayer beads. The Buddhists copied the Hindus. The Muslims copied the Hindus and the Buddhists. The Christians copied the Muslims in Spain with their prayer beads. And then you get the rosary, right? So this is global. It's all over the world using beads. So I have beads in my office, and I've been known to set them before students and others who are in crisis, to let them begin to create a necklace, if you will, a chain of beads. It's a physical representation of making meaning, right? You're taking the experiences that you're going through and you're putting them into a necklace. You're creating a narrative, a new narrative, powerful, with a physical act. Some people who come to me need me to sit behind my desk when I talk with them. They need that. They need somebody to look like an authority figure who knows more than they do about stuff, right? They need that. And I try to attune myself to this question. Does this person need me to sit at an angle, like this angle, like that with them? So I'm looking at them at the side, so that, do they need me to sit at an angle with them out in the open area of my office? Peer-to-peer kind of feeling to drop down some of the social distance? Or do they need that social distance in order to feel like they're being helped, being served? Yeah. So having options in the layout of your space. Same with garb, right? I am kind of an old hippie, you know, so I don't wear clerical stuff very often. But there are times when the people I am serving need me to put on the stole or the robe or some kind of signifier of my clerical status, and I'll do it for them, right? I've got that kit in my office too, right? So think about, you know, kitting out your office, your exam rooms, etc., with material that will be invitational to a variety of people with different practices or different beliefs or different ways of tapping into their own spirituality. So that, you know, conversation starters, door openers for your patients. These are some of the factors. Alexa asked me this question of how things have changed over the years. And again, I think the main thing that's changed is that I more and more, I've just had to like dial in to people's energy. You know, it's intuition, right? It's the cultivation of intuition. What does this person need from me? How can I serve them uniquely, right? Not my way, but their way, right? Or a way that serves them, even if it's not how I usually do things or how I usually talk. And yet still be genuinely myself. I'm not trying to be, you know, a Peruvian shaman. Forget it. I'm not. I'm a white Christian pastor, progressive Christian pastor in America. I'm not trying to be somebody else. But what can I do within my capacity and without violating my selfhood, without violating my authenticity, that can reach this person and be invitational for this kind of conversation and for this experience, this ritual experience of this encounter. We're priests, we're shamans, and cultivating that skill of shamanism, if you will, of ritual will serve patients. I'm at your service, burklo@usc.edu. Love to hear from you, and fight on for whole patient care.